So what are some of the concerns? A lot of people don't have employee assistance programs because they're seen to be expensive. And sometimes employees don't take advantage of them. So even though an employer doesn't find out who's used it or what they've used it for, sometimes, well, they always find out if it's being used at all, right?
Right.
So in that case, if people haven't used it in the past, I know I have one client that they had an EAP program and they dropped it, they let it go a couple of years ago because they didn't have anybody using it. Um, so now, given the situation, with the pandemic and with people working from home, there's a lot of different challenges. So maybe um, we were just speaking about, before we started recording, speaking about mental health being a big concern for the new world with people feeling stressed, employees, of course, but employers are taking a really hard, it's really challenging for them because they don't want to let people go. They want their employees to be safe. They're not sure if they should send people to work from home. They don't know what people are doing when they work from home. So, like you had mentioned, a lot of employers are losing sleep over this. But maybe you can tell us a bit about what an employee assistance program could do, and if there's some ways that we could be looking at what to do for employees.
Well, I think for me, the biggest thing uh, is that an employee assistance program is something that's fairly new to the business community in Prince Edward Island. In fact, employee benefits for a lot of employers is fairly new because we have a lot of small to medium sized businesses, and it kind of grew from one person or two. And maybe when they inquired about it, they couldn't find anybody that sold a policy that would fit their situation. So I don't know if a lot of employers have really seen the benefit of having something in place to look after the mental health of employees, not only for the employees, but for their spouse and for their children. We're getting more requests from the spouse's side and the children's side
Yeah.
because the children are under an awful lot more stress than we would really want to recognize. Um,
And I think
so,
too, with that, like kids, they're more aware and accepting of mental health issues, and the school systems have been providing counseling. I'm sure they're full to capacity, but then they can only do so much now when kids are home. I don't know how that works with school counselors and anybody who does have a tendency towards anxiety. Um, it probably is ratcheted up, given that now we're talking pandemic 24/7. We're talking about the economy. We're talking about staying at home, not seeing your friends. So what kinds of things could uh, an employee access for their kids even with an EAP?
well, the EAP program will help deal with situations of stress, or if you have, let's say you have a difficult child and you really don't know what to do, you
Mm,
can phone a toll-free number and you can talk to somebody independent from your workplace. Um, I think we have to probably train employers because employers became the counselor not only for their employees, but for the community. People would drop in about what do you think or have a business idea and eat up a lot of their time with issues that really they don't have any control over, nor do they want to hear a lot of this stuff because a lot of it's very sensitive information. Um,
and a lot
so
of
with it,
employers, I do find I work with employers in the helping sector. So childhood educators or healthcare professionals, those sorts of things where they can have a tendency, they get into these careers because they want to help people. And then what sometimes I've heard from them is they start to almost act as a counselor for their employees and they're not trained for it.
no,
They don't have the training or professional expertise to know how to help an employee but also maintain that professional distance that they need because they are their employer, and they can't take that stuff on themselves because it's very, um, it's emotional labor.
Yes. And I think you hit the nail on the head. We don't have the training as much as we'd like to get involved in people's situations and try to be helpful because that's the business that we're in. We don't have the training to do that. It opens us up for a lot of liability. You know, I had an electrician in my office yesterday, and he said a friend of his was giving him advice on life insurance, and he shouldn't buy this type of insurance. And I said, well, if you have a plumbing issue, do you go to a plumber? Electrician, electrical issue, you go to an electrician. Car issue, you go to a mechanic. So we need to separate these things into the expertise that's there. We can have a little bit of basic knowledge, but especially when we're dealing with mental health issues, we need to call in people that deal with this on a regular basis, because we never know what the underlying condition is.
Yeah.
And we don't want to get caught in the position of being an enabler where people keep coming back and they just give you enough information so you kind of keep the situation going, but it never gets resolved.
Yeah. Yeah. I know I've jumped into situations where I thought I had the information because it's what the employee presented to me. And I just jump into action, more or less, because I feel like people are coming to me for a solution in the role that I do. And then I realize, oh my gosh, there's so much that needs to be unpacked. Let's backpedal quite a bit because we need to deal with all this other stuff. And it may come down to, you know what, the best thing right now is if you go to use your EAP or get a counselor, get somebody to talk to that's a professional in that area to help you unpackage everything and deal with, like you say, get to the source of it. Because also as an employer, if they find out all of that information, they can treat the employee differently. And if you ever let that employee go for whatever reason, it could backfire on them, right? With a claim of constructive dismissal, you're treating me differently because you know I have mental health issues, blah, 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 blah.
Right.
So yeah, getting to the root of it and also distancing from it as an employer is really important.
Right.
Yeah.
Yeah. And I think the other thing, which I'm glad that you've started by having, you know, discussion or having the courage to say, well, I'm going to have some Zoom meetings and I'm going to put that on Facebook and send it to a bunch of friends. I shared it on all my Facebook stuff. And I think we just need to keep doing this because this is even different for people. When on PEI, when we want to have a meeting, we want to drive an hour each way, you know, and sit down for at least 2 hours and talk about nothing and then drive an hour home.
At least, yes.
At least.
Get the good of the gas.
Yeah, and then come back again and then regurgitate the same stuff all over again and sometimes not get a lot accomplished. Where I think if we can put in a format where people can take away bits and pieces and not eat up into their day, this is going to be maybe the new norm. We're going to be communicating by video chat, finding ways to get paper back and forth that's legal and will work. And we're going to be working from home. There's going to be more people that are going to be working from home. They're going to feel isolated. So an EAP program is probably more important than ever before because I don't have that interaction at the workplace. I'm at home. I feel kind of depressed. I don't know who to talk to. Everybody's busy.
Yeah.
Right?
Yeah, absolutely.
Yeah.
Well, this has been great. Thank you so much.
Yeah.
Information, and we'll talk to you both soon.
Yeah. Sounds wonderful.